is TMS treatment safe for kids?
You know, I like to think so. Like I say, I've used it for autism.
Mm-hmm.
Right. I think that it's once again, we don't have the lovely safety data we would absolutely love to have.
Okay.
I first to say though, I had a young child and they needed TMS. I would do that before a medication. Absolutely.
Amen.
So
Amen.
I feel, yeah, enough safety about it that would be my choice as a parent. I think it's tricky. I've treated a lot of at least 16-year-olds. I think that's
Okay.
16, 17. I've treated a lot. We've gotten insurance coverage for a lot of those kids too,
Okay.
which is amazing.
I've seen a lot more of that lately. That going a little bit younger, which is
Yeah.
nice.
Great. I think they're moving that way. And like I
Mm-hmm.
said, I've treated the young kids on the spectrum very safely, and I wouldn't do it if I thought there was a problem. But can I with really evidence-based research literature say it's all safe and with the developing brain? I can't. My gut is it is. And like I say, as a parent, I would do TMS over a medication for my child.
Full disclosure, I've treated my child, so
Good for you.
9 years old.
There you go. How they do. Good.
Loved it.
Yeah.
Loved it. There's a
I
video
treated
on it. Go
I
check
treat
it
my
out.
daughter too. Older. I mean, not in 20. So I know, you were talking about I do MERT therapy. I do it like I do the EET, I'm on my preventative health cognitive kick.
Mm-hmm.
Right. Sometimes my staff laughs because like I go in and do it. Sometimes I'll just do it myself, like because I know like you put up a big mirror and they'll cut me off. They're like, Martha, like you're like you're having too many ideas and you're too on it. Like you gotta take a break. We're cutting you off with the
I
MERT
love it. I love it. If you've done TMS,
Yeah.
that a
Yeah.
girl.
Yeah.
Girl, how many
Absolutely.
sessions?
I've done 3 rounds. Like full.
Okay.
Yeah.
Okay.
Yeah. Yeah.
I did 100 and my 134th session I did today.
Wow.
My staff counts them for me. What
There
session
you
is
go.
this?
There you go.
134,
There you
Kyle.
go. Well,
Okay.
you're past me, right? Because 30, I've done
Yeah,
108.
yeah. Uh-huh. Well, so my first round was 40 sessions, right? Um,
Yeah. Interesting. Yeah.
and I mean, I was in bad shape. Kyle wasn't really the best boy at that time of his life either. So a
Okay.
lot of damage had been done.
Yeah.
So those 40 sessions cleaned me up real nice.
Great.
And then
Yeah.
I ended up buying 2 chairs, or two
Awesome.
different chairs.
Cool. So
So yeah.
you do continuation or maintenance.
Maintenance.
That's
Um
what needs to be approved too, right? Like,
uh and so I did a session last week. I did a session today.
okay. Yeah. Yeah.
Um no reason other than I knew I was going to talk to you and I wanted to be my highest performance,
There you go. Yeah.
and I do believe it's in best words I can find right now, it's a performance enhancing drug.
Yes.
And
Yeah.
I do know professional players that use it that way.
Yeah.
I've
Yeah.
treated Hall of Famers here in this office.
Okay.
Um, active professional,
Yeah.
right? Athletes. And no, that's I want to see more of that. And they won't let me yet,
Right.
but I'm working on getting them on the channel to humanize this process.
Yeah. It's
Um,
so hard, right? When I think, deal with that population. Yeah, we had I've tried, we're right near like the LA
uh-huh.
for hockey. We're near the new site for the Chargers and the Rams. And I've tried so many times, Kyle, because I worry so much about, chronic traumatic encephalopathy. And I like if these people were
Yes.
thinking right, they would in their off season, everybody would do TMS.
Yes.
Right? Like particularly maybe the MERT. Like and there's just such a block, I think, in terms of wanting to acknowledge any brain injury with the sport. It's just a wall that I keep like I can't get in. So if you get in,
Mhm.
let me know. And the
Well,
interesting thing, I treated a professional football player's son.
okay.
Had to learn it was really for a math disability. He did the MERT. So there's another child, did great,
Okay.
right? Did great with it. And I said to him, hey, I'll treat you for free. Like, I just want you to see
Yeah,
what is,
yeah.
treat you. And then you talk to your
Yeah.
buddy, right? Talk
That's
to all
right.
your pro guys.
That's right.
So he says to me, okay, like I'm really busy now. like in the new year, right? This was a couple years back. So sure enough, I follow him up with him and he's like, like he's just too anxious to do it. Right.
Yeah.
Which is really sad. And I get it. I get the culture around that. But it's to me like
I think
professional
that's a big part of
athletes
it though.
not using that. That is just crazy. This is such a valuable preventative tool for them, as well as peak performance, as you say.
Yeah. Yeah. The CTE is a huge one. My best friend committed suicide, and I
Oh,
truly do believe in my heart, knowing the man, I knew him 33 years, that was a humongous factor of what was going on with him. And you see it all the time. You
yeah,
see it all the time. And if we can help with that, you see the culture, men don't cry and all these things. The 22 veterans a day. That's what I focus on a lot here in my clinic is veterans. Getting
yeah,
these boys and girls into the chair.
yeah,
Watch. Just
yeah,
give me a couple weeks and tell me you don't feel better.
yeah,
Watch,
yeah.
yeah. So
Yeah. No, that's beautiful. Yeah, we struggle with TRICARE too. We accept TRICARE. It's very hard to get them. They'll come, then we try to go back to their primary, like we can't get them in, right?
they'll call their PCP, get the referral, and they're gone. They're gone.
Yeah.
I live in Temecula, right?
Okay.
I got Camp Pendleton right
Yeah.
down the road.
Yeah.
My little valley here it's a military valley.
Right.
So many active duties, and they want it, and they're like, go to your PCP, and they're like, bye, Kyle.
Yeah, that's right. That's what happens to
Talk
us.
to you later. And I'm like, it's
Yeah.
sad. It's so
I know.
sad.
I know.
Um,
So there's a it's called ETMS Ohio.
okay,
And it's a organization that has established government funding. I think they've done it in Ohio, maybe Michigan, don't quote me. You can do etmsohio.org and they're literally, I've tried to get them to come out to California, but it's all for TMS for veterans. It's the ETMS, right, for PTSD really for veterans. And
okay,
they yeah, they're really, they've made a lot of headway in certain states. So that's promising to me, right?
wonderful. That's
Yeah.
wonderful. I'm treating a veteran right now. He had done TMS before. He had done standard TMS, and I'm giving him PR TMS,
Okay.
personalized repetitive, right?
Okay.
And he did standard TMS 2 years ago. He did 2 or 3 sessions of PR TMS, and he was just like, Kyle, night and day. I feel amazing. I think it was his third day. He said, this is the first day I don't want to take my life,
Okay. Yeah.
and you're like, shit,
I
come
know.
on.
Say that.
And so him and I are working on a couple things to help
Yeah.
and get
Okay.
more of them in the chair because the 22 a day breaks my heart. My
I know.
grandfather's a Montford Point Marine, right? First Black Marine Corps unit. And
Wow.
it's my passion to help.
Yeah.
Just naturally, I think I'm born that way, but then I have 90 years of military service above me.
Yeah.
Um, and so I really am passionate about helping them so much, but
Yeah.
it's so hard, right? So many hurdles to jump.
I know. I know. But so important, right? To just keep
So
pushing.
important. And we just got to keep jumping them, right?
Yeah.
Keep
Yeah.
jumping them. That's all
Yeah.
we can do.
Yeah.
Hey guys, I know you liked that video. Do yourself a favor. Click on this one right here. More content about TMS, the benefits of TMS, and how we're going to change the world with TMS. Did you click on it? Click on that one right there.